Hi everybody, it's Tremia, and it's been another few weeks, if not longer. I'm sorry it takes me so long to get back. Um, Recuperation is slower than what I wish it would be. Um, I had in my mind that, I was going to be doing cartwheels and somersaults by now. But I'm still, we have the hospital bed set up in the living room and everything. Um, I have my personal care aide. I have my home health nurse and everything that comes by. So, still basically just in the beginning stages of trying to get well. Um, Everything's going good without my home health care aide. I love her to death. Um, she takes good care of me and of the home. I don't mind her being here. Like, I don't question what she's doing or anything. She's just a true blessing. She comes in and she gets to work. I don't have to tell her what to do. She just does it. But if there's certain things that I do need done, I'll tell her when she very first gets here. And, she makes sure those things get done that day. So it's worked out as far as that is. It's better than what we could ever ask for. And what position we were in, because we were going to be here. I was going to be here without anybody to take care of me. I'm getting to where I can sit up on the edge of the bed by myself. I still, as far as like walking, that was the dryer. As far as walking, like to the bathroom and back, that's basically my exercise and my movement. And I can't do that unassisted. I either we have my scooter in here. It's according to how bad I am that day, how bad my pain is. We'll either use the walker or the scooter to get back and forth. Yesterday I had a visit with my back doctor, which is the very first time we've actually got to speak to an actual doctor concerning my back, because everything's been like an emergency surgery. I've had 15 fractures of my vertebrae, 15 different fractures, 15 different vertebrae, and they go in, they do the emergency surgery. I was in the hospital, so I didn't go to a doctor and he looked at me and say, we need to do this. They just wheeled me down to the surgery and did it. And on this doctor, he did my last 2 kyphoplasties, but again, they were emergency, and never got to speak to him until yesterday. And he said that I'm not first place. I've had 15 fractures. First place is 16. And I'm actually tied for somebody in second place for 15. And he's been a doctor for 20 some years. Maybe close to 20 years. And I said, I don't want to get that trophy. I'll just stay where I'm at. I'll stay with 15. He's going to go in a week, thereabouts, and he's going to do a medial nerve block to determine how much pain is actual nerve pain, which I know there is over here because it just burns, versus how much is bone pain. And he said that I should have a significant amount of bone pain because my osteoporosis is so significant that there's no way my bones could not hurt. As far as physical and occupational therapy, I cannot do it for another year because my bones are so soft and fragile, it'll just break them. And I said I understand that because at least 2 instances in the hospital when they were doing physical therapy, they fractured my vertebrae. just by doing the physical therapy. So that's a year. I got to continue to take the Forteo and my calcium and vitamin D. I misunderstood Dwayne on the results of my bone density. I thought it was better than what it was. My one hip is negative 2.5. The other one's negative 3.0. And I thought it was negative 2.0. So, it's quite significant. And so he's going to find out how much, if that medial nerve block helps any, they can go in and do a permanent ablation to where it permanently numbs it, so pain signals won't go to my brain from the nerves there. But that's something I want to think about because it is permanent. He said it won't numb my back or anything like that. It just keeps those signals from going back and forth. So it's something I need to study, research, and Dwayne and I will figure that out. The other thing is the pain pump is an option for the bone pain to get it under control, which you can tell I'm getting in worse and worse pain as I sit here. And that pain pump is a scary thing. It's a very significant procedure, requires a good amount of surgery, and just a lot of things to consider in all of that. So, we're nowhere near saying yes to that yet, although I'm tired of all this pain and it just takes my breath. The best thing I can do is lay down and in one position, not move, and my pain is at a level 8, to where right now, it's a 9 heading towards a 10. So I don't want to cry on you guys with the pain. But so I'm going to be calling it good for here in a second. So, but I hope everybody's doing good and enjoying the holidays. Thank God for online shopping. That's how I got my Christmas ordered for everybody. It was fun. At least I got to do some shopping. I've got a lot to consider over the next few weeks and hopefully get pain under control. They want to make sure that as far as doing any surgery like that pain pump, they want as much time between my last infection and going into surgery as they can get. So I don't know exactly how long that is, but I'll find out next week. And because I don't want to go in and then get an infection, because I'm still in that critical period where they said that these next 3 to 4 months are critical for me not to end up back in the hospital, or I basically wouldn't be coming out. So I take that very seriously. I do not want that to happen. But all in all, I feel everything's on the upward. I'm not getting worse, not going downhill. We all know what that feels like, and I'm nowhere near that. The main thing now is just dealing with the pain. I'm going to go for now, and I will see you guys in the next video.